Hello everyone, I'm Liliana Andrade, family medicine and geriatric physician, and today we're going to be diving into preventive medicine and health maintenance for the older adult, part 1. So let's get started. Preventive care in older adults focus on individualized decision-making, prioritizing interventions that maximize benefit while minimizing potential harm. Here's what the latest USPSTF, United States Preventive Service Task Force guidelines recommend. First, let's talk about cancer screening. For older adults, screening should consider life expectancy, comorbidities, and the potential for harm. For breast cancer screening, the American Cancer Society recommends annual mammograms for women aged 45 to 54 and gives the option of transitioning to biannual screening or continuing annual mammograms starting at age 55 depending on women's preferences and health status. In contrast, the USPSTF recommends biannual screening mammography for women aged 50 to 74, with individualized decision-making for women aged 40 to 49 based on the personal risk factors and preferences. For those over 75, discuss the screening based on individual health and preferences. Now, let's talk about colorectal cancer screening. The USPSTF recommends screening for adults aged 50 to 75 with selective screening for those aged 76 to 85 based on individual health status and life expectancy of at least 10 years. Here are the main screening options. Number 1 is a fecal immunochemical test, FIT, done every year. It's a simple stool test that can be done at home that detects hidden blood. Pros include is non-invasive, no bowel prep needed, and low cost. Cons must be done annually, and a positive result requires a follow-up colonoscopy. Number 2 is a stool DNA test known as the Cologuard, which is done every 3 years. It's a non-invasive test that checks for DNA mutations and blood in the stools. Pros include that it's more sensitive than FIT and only needed to be done every 3 years. Cons has higher false positive rate, and the positive test still requires a colonoscopy. And last but not least, colonoscopy, which needs to be done every 10 years. It is the gold standard and it allows direct visualization and removal of polyps. Pros is done every 10 years and is diagnostic and therapeutic, and cons requires bowel prep, sedation, and has potential risk for bleeding and perforation. Now, let's talk about lung cancer screening. An annual low-dose CT is recommended for patients aged 50 to 80 with a 25-year smoking history who currently smoke or quit within the past 15 years. Stop screening once they have quit for 15 plus years or have limited life expectancy. Regarding cervical cancer screening, this is unnecessary after age 65 if prior tests were negative and the patient is not at risk. For prostate cancer, the USPSTF recommends shared decision-making for men aged 55 to 69 regarding PSA-based screening. Routine screening is not recommended for men aged 70 and older as the harms typically outweigh the benefits. For elderly patients, consider life expectancy, comorbidities, and their values when deciding whether to screen. Now, let's move to cardiovascular health. For aspirin use, the USPSTF no longer recommends aspirin for primary prevention in most adults over 60 due to bleeding risk outweighing benefits. Focus on managing existing conditions like hypertension, diabetes, and dyslipidemia. Target blood pressure is less than 120/80 for most older adults per American College of Cardiology and the American Heart Association. However, avoid overtreatment in frail or low-functioning patients. For lipid screening, periodically reassess lipid profiles and consider statins for primary prevention in patients aged 40 to 75 with a high ASCVD risk, balancing risks and benefits in those over 75. For abdominal aortic aneurysm AAA, screen men aged 65 to 75 who have ever smoked with a one-time abdominal ultrasound. No routine screening is recommended for women or non-smokers. Osteoporosis screening is essential for fracture prevention, especially in postmenopausal women and high-risk individuals. The USPSTF guidelines recommend screening with DEXA scan women 65 and older every 2 years, and for women less than 65 if FRAX score is equal or more than 9.3%. For men, routine screening is not recommended, but consider for high-risk men 70 and older or 50 and older if they have risk factors like previous fracture or chronic steroid use. For further details in osteoporosis, you can click the link below that I'm going to leave in the description box. Preventive care in older adults should be individualized based on overall health, life expectancy, and patients' preferences. Next week, we will be discussing other screening recommended for the older adult. Just keep tuned. If you enjoyed the video, please like it, share it, and subscribe.